The skin is an elastic, self-regenerating cover for the entire body. The primary functions of skin are to protect the body from microbial and foreign substance invasion and to protect internal body structures from minor physical trauma. Asking the patient about their occupation is important because highest incidence of chemical exposures to the skin include food service, cosmetology, healthcare, agriculture, cleaning, painting, mechanics, printing, and construction. Start with a journal survey, noticing the color of the skin, pigmentation, any bruising, and lesions or discoloration. Notice any unusual odors too. Before you start, be sure to have adequate lighting so subtle changes are not missed. Be alert for cuts, bruises, scratches that may indicate interpersonal violence or domestic violence, especially when explanation for the cause does not seem to fit the lesions observed. If a tattoo is present, its location and the characteristics of the surrounding area should be examined and documented. Please read about the following in your textbook: pigmented nevi, moles, freckles, patch, striae. In your expected findings, the skin should be smooth, soft, and intact. The skin temperature is best evaluated using the back of your hands, and the skin should be warm. The skin temperature should be consistent for the entire body, with the exception of the hands and feet, which may be cooler. The skin is normally dry. Skin mobility and turgor are assessed by picking up and slightly pinching the skin on the forearm or under the clavicle. You're checking hydration status of the skin when checking skin turgor. The skin should be elastic. That means it should move easily, being lifted and returned to place immediately when released. Poor skin turgor is noted if tenting is observed or if the skin slowly recedes back into place. Decreased turgor may result from dehydration or may be a finding in an individual who has experienced significant weight loss. And you might see that in elderly too. Findings under skin turgor might be taut or tight, and that happens when a person has lots of edema or fluid retention, which reduces skin mobility. When assessing the scalp should be smooth to palpation and show no evidence of flaking, scaling, redness, or open lesions. Examine the quantity and distribution of facial and body hair. It will vary between males and females. Nails should be checked for shape, contour, color, cleanliness. In light-skinned individuals, nails are pink and blanch with pressure. People with darker pigmented skin, typically they have nails that are yellow or brown, and vertical banded lines may appear. If you find nails to be thin and brittle, that may be secondary to poor peripheral circulation or inadequate nutrition. When you describe a lesion, be sure to include the following information: location, size, and color of the lesion. Shape, if it's oval, round, or irregular. And borders, if they are regular or irregular. Any elevation, if they are flat, raised, or sunken. Any other characteristics, for example, if they are hard, soft, or fluid-filled. Any pattern to them, if there is more than one lesion present. You want to know and read about early signs of melanoma. And to help you remember the early signs of melanoma, use the mnemonic A, B, C, D, E, F. A for asymmetry, not round or oval. B for border, poorly defined or irregular border. C for color, uneven, variegated. D for diameter, that will be usually greater than 6 millimeter. E for elevation, recent change from flat to raised lesion. F stands for feeling sensation of itching, tingling, or stinging within the lesion. Patients with limited mobility are at risk for skin breakdown secondary to pressure and body fluid pooling because of an inability to feel the pressure or a decreased ability to independently change position to relieve pressure. So in the hospital, you will see orders like turn the patient every hour or every 2 hours if they're unable to move themselves in the bed. The nurse should examine the patient's skin, especially over bony prominences. Patients who operate their own wheelchairs are at high risk of developing hand calluses, so make sure to examine the patient's hands. Centers for Medicaid and Medicare services will not pay to hospitals for conditions considered reasonably preventable that are also called never events. They should not happen. Hospital-acquired pressure ulcers are included as never events. All patients admitted are carefully assessed for pressure ulcers. When any pressure ulcers are found upon admission, they are photographed and documented. To prevent development of pressure ulcers, nurses assess patients at risk. For example, patients who are immobile, who are incontinent of urine or stool, or have nutritional deficiencies. Preventative interventions are implemented, such as keeping the skin clean and dry and free of prolonged pressure. If nurse assesses and finds a pressure ulcer after admission to the hospital, it will fall under hospital-acquired pressure ulcer. They will need to collaborate with a wound care nurse for early interventions to prevent further skin damage and regain skin integrity. Assess all contact and skin pressure points for patients who have limited mobility. When a red area of skin is noted, blanch the skin by applying gentle pressure over the red areas. If the skin becomes white or blanches upon application of pressure and reddens again after pressure is relieved, the circulation to that area is sufficient and the redness will disappear. So Sirat, I'm going to go over Braden scale with you that is used for predicting pressure sore risk. Okay, so sensory perception wise, you have been responding to my commands and I did not notice any sensory deficit. That would limit your ability to tell me if you were in pain or any discomfort. So no impairment noted in that one. So I'm giving you 4 there. Moisture wise, your skin is dry at this time. Do you have any problem with incontinence?
No.
Nope. Do you get like any night sweats?
No.
Okay. So your skin is usually dry and so I will be giving you 4 on that. So it's rarely moist. Okay. And activity wise, how often do you walk around? Like, do you take walks and do you have any difficulty with your activity or your, okay. And I saw you kind of walking to this bed too. So I think I will give you 4 for activity. You walk frequently. Mobility wise, you can walk and get to that chair and come back and very easily. You drive around, so no problem with mobility, and you can change your position on your own. You don't need any help with that. Okay, so I will give you 4 on that one. What about your nutrition? Do you eat most of your, all your meals? How often do you eat?
2 to 3 times a day.
2 to 3 times, like whole meal?
Whole meals.
Okay. And do you take any snacks in between too?
A couple of times. Yeah.
Couple of times. Do you ever refuse a meal?
Sometimes I don't eat breakfast.
Okay. And do you take all the servings of meat and dairy product?
Yeah.
Okay. So I will give you, I feel like if you are kind of skipping the breakfast and everything, so I won't give you excellent, so I will give you adequate on that one, so 3. Friction chair, as you said, like, you are able to kind of move around, you don't need any assistance with that, and you can maintain your good position in bed or chair, so no apparent problem with friction and shear. So I will give you a total of 22, so you are not at risk. So as long as it's between 19 and 23, we are good over there. And we can do some teaching with you about your diet later on too, and we can go over that. Okay, that's good.